Recording in progress.
We are official. All right. I'm Michelle Riegel, Chairperson of the Library Trustees. I call this meeting to order at 7:06 p.m. We have all board members in attendance. We also have Library Director Jen Bruneau, Assistant Library Director Caitlin Stacy, and we have our guest this evening, Mara Dede, who will be helping to present the discussion of the Health and Wellness Plan. Correct? My opening remarks, essentially. First item of business that we have. We stripped the agenda of things like financials and minutes to give more time to the health and wellness plan discussion. Do need to appoint the nominating committee, and this nominating committee will be Brittany Burns as the chair, Beth Thomas, and Jim Hogan. All right, I've sent you an email. See, I'll remember what positions you're nominating people for. A reminder about it being a public meeting, so you have to have an agenda and so forth. I think that's all I need to tell you right now. Yes, Jim, I will send you all that stuff.
And I've done this several times.
Good, so you'll be my guy. I'm letting you know right now.
Right. Well, having gotten that piece of business out of the way, we will move on to the part of tonight's meeting, presentation and discussion of health and wellness plan.
Okay, great. Does this automatically move and follow me?
It does. Yeah.
No, for whoever's speaking, not just to me.
Yes.
Right, make it just.
Second recorded event of the day. Great. Well, hi, everyone. Thank you so much for having me in real life at your board meeting tonight. It's a real privilege, and I appreciate you taking the time out of your busy trustee business to make time for our presentation of the draft plan as we have it now. That's me. So my name is Mara Dede. I am the principal and founder of Local Library Consulting, and in that role, I work with libraries to help identify strategic priorities, do evaluations and assessments, review policy, basically working with libraries, harnessing the local expertise and talent to try to find the opportunities that the library can achieve to make good libraries continuing to be great. And also sometimes dealing with libraries that are in a bit of pickle, need a little bit of help writing the course as well. It's been an honor to work with Jen and Caitlin on this project. They're incredibly smart and thoughtful and creative, and the staff as well. I've had several opportunities to connect with them throughout the process as well. So I thought, so our agenda tonight is I'm going to give you an overview of kind of the project. Jen's going to talk a little bit about how it started. I'm going to tell you the work that we've done that has led up to where we are today. And then we'll give you a presentation of the draft strategic priorities that we came up with for health and wellness and some of the goals, and we'll have a discussion. There's 3 of them. We'll have a discussion after each one. So this is really the goal for today that I'd like you to keep in mind is that, so I'll review the draft plan and feedback, but what I would like you to have in mind is you had an opportunity to review some of the engagement that we've provided is, did we miss anything? And does this really capture the community's needs and aspirations? So I'll remind you of that question as we go along, but this is really our goal today. And hopefully have a constructive conversation about the priorities and the goals, what's missing, how those came to be. I'm not there. Okay, so project overview. Do you want to start with this?
So, this will go into a little bit of recap of the history of how we got to where we are today. And I have some word vomit notes that I think will not serve me at all. So if you were around in 2020 when I started, library was shut down for the pandemic. People were, let's just say, miserable. The community was struggling. One of the things that we really heard over and over from our patrons was that without the library being open, a lot of people did not have their social outlet. And as much as we could try, we were not necessarily able to do things for the community that we normally would want to do. We couldn't have programs, we couldn't talk to people face to face. People couldn't come in and explore the collections and get answers to their needs. I don't know if anybody could predict at the time what the lasting impact of the pandemic was going to be on mental health. And I think in some ways we might still be identifying those needs and sort of the not so immediate but midterm sort of impacts of social isolation and all of these things. So one of the things that for me was a lifesaver was the Be Well Northborough initiative, which was co-headed by Kristen Black, who was the health director at the time, who is maybe one of the world's most amazing humans. And what we wanted to do with all of those town departments was get together and create a more holistic approach to addressing the mental health needs of the pandemic. And the focus was on COVID, and sort of emerging from that social isolation as people started to move about again in different ways. And what could we do together that we wouldn't be able to do separately? And in many ways, that's one of the most successful projects that I've ever been a part of. We still are doing some work sort of unofficially with that, even though most of the funding for that initiative is gone now. One of the things that we came out with was the community resource guide, which I think has been incredibly helpful for community and frontline staff for sort of dealing with the emergency or urgent needs of various departments. But one of the things that I learned through that partnership was how confused people got when they saw that I was one of the chairs of that committee. What is the library doing? Running a health, right? And we're very insular. We understand what libraries do for people's health and mental wellness and well-being, and how that fits in might just intrinsically make sense to us, but it absolutely does not necessarily resonate to everybody, including some other department heads or former staff members at the time were like, why the library director? Is it just because she's nice? I remember somebody saying, is it just because you're easy to work with? And you said yes. And in some ways, yeah, I asked who was in charge of the initiative, and they said, well, you are now. That's how that happens. And I said to Kristen, you're helping. So that led me down this train of thought of how are we telling our story to the public? And that gets into some of the marketing conversations that we've had before. And just sort of how are we telling people about all the ways that libraries impact community and serve the community? And do people even know that they can come to us for certain, or do they just see it as a place for story times and books? Those types of things. So that is one train of thought that helped lead to this idea. The other line of thinking that was occurring at the same time, I was new. So I spent a good deal of my first year in any job sort of listening to the staff and observing the ways in which they interact, the programs that they do, and the needs that they have, and sort of learning how I can be an advocate for them, a support system for them, what their struggles are, what the opportunities are. And I started to realize that, you know, there's a lot that we can do to bolster and amplify what the staff are already doing, and in some ways make it easier for them. Because there are some things that they're doing to the best of their ability, but with funding or capacity or even just an intentional focus on something, we could do better. Thing on training and thoughtful innovations for services and things like that. So that was another sort of train of thought. And then the third sort of component to this is sort of bigger outside of the library. I remember very well the public input session that was held at the church. I remember
Trinity Church.
Yes, at Trinity Church, where the public got to weigh in on what their needs were in terms of how the ARPA funding was to be spent. And that for me really stuck with me. That was something I watched back several times. I read a lot of the notes and tried to think of the express needs of the community in terms of how the library's mission and how those started to fit together. Started looking at some of the work that local agencies like Metro West had a study of mental health impacts from the pandemic. They had a few other sets of data that they had published. There was a consulting report on health and human services that led to the combination of the health department with the family services. So listened to select board meetings, just sort of gathered as much information as I could, because I just kind of became fixated on like, how do we help our community become stronger out of the pandemic? And as we got further and further away from the pandemic, it turned to like, what are these lasting impacts? What does the community need? I think it's evolved even more since the project has started with economic uncertainty, the rapidly evolving landscape in terms of technology, making it a little more difficult for people to identify reliable sources of information. All things that kind of fit into the library's mission and the strategic goals. And I wanted to make sure that what we were doing aligned with those needs, because I think mental health and physical health are sort of at the top of everybody's priority list post-pandemic. So I got this wild idea that maybe if I combined all of this into an intentional, deliberate, focused plan, that we could really create a blueprint that would align our mission and our work with the needs of the community post-pandemic, and also amplify the work that is already being done by my staff. I have the most empathetic, hardworking, dedicated, caring staff in the whole world fighting. Right, wrong. And a lot of what they're doing is not necessarily being seen, and things that they do, the impact that they're making is sometimes overlooked. So Caitlin and I started having a lot of discussions. She was the first person that I said, what about a health and wellness plan? And by this time I had Googled to eternity and could not come up with, there's no library that has done one of these. So this is completely new. I made it up. It's whose line is it anyway in libraries. And what I was hopeful for at the end of it was something that would amplify the work of staff, give us a blueprint for better marketing, which is an area that we all kind of know that we can run. So that people outside of the library world can connect to what we're doing and understand our story as it relates. Find ways to intentionally look for ways to meet the needs of the community. Figure out what it is that we can do, and maybe almost as important, what we don't do in terms of health and wellness. We're not doctors, we're not experts, there's a lot of things that we are not. But how can we pull in those people and amplify their work too? So with better partnerships, what can we do? What can we accomplish? Be Well showed us all as department heads that were involved in that project, what we can accomplish together. And it's so exponentially greater than what we can accomplish by ourselves. And then I am very aware of the economic situation that country, the state, and down to the regional level town is in. And I'm sensitive to the fact that money is always going to be kind of a thing. So my third sort of in importance role for this plan was to set up a structure that allows us to think outside the box in terms of funding support. So if we're telling our story in a slightly different way than we have been in the past, we might be able to attract new funding sources, especially with library grants becoming a little more scarce and way more competitive. That being said, I would like to take this moment to announce to you all that we did secure a $10,000 grant from the American Library Association for services and collections that will help serve caregivers and those who are struggling with memory loss related to, or cognitive decline related to age, dementia, Alzheimer's, and anything that kind of falls under that realm. So Kate Ponce, our reference librarian, was instrumental in writing that and getting all of the information together. So we are now, a couple of days ago, we were given permission to announce it, and I said, I'm going to wait. And actually, some of the survey work that we did here was used in that grant application. So even though we don't have a final plan yet, if you look at the initial $20,000 investment of ARPA funding, we've already gotten half of that back. Yay, yay, Kate.
Second clap for that. Yeah, we got it.
So this is the first time that I've ever worked with a consultant ever. Generally, it's like, oh, really? The idea is a little outside of the box, and I felt like I needed outside help to come in and help focus the surveys that we're doing and kind of help me give life and structure to this idea that I had that I was having trouble articulating on my own. So we brought Maura in, sort of like ARPA funding. Hopefully, once we're finished with the whole process, we will have something that we're proud of that helps tell our story and sets us up really to continue some great work in connecting our community, building a strong North crowd, and addressing some of those unmet needs that our community has.
That was great.
Yeah,
I guess it was. That's not what I said. Yeah, that was great. And we've had this conversation a while ago, but it's really helpful to hear it at this moment. I think maybe I'll just tell you a little bit, I think more about me, and I think kind of like how I work as a consultant, where I have never worked on a project like this. Like I've done sort of strategic planning. So there's, kind of that idea of a framework. But when I approach any project with any client, it's really about figuring out what's the local needs here. So where is the library and the community at today, and where would it like to go into the future? And so I spend a lot of time listening. And I think this skill has been honed by my time at NBLC, where I was a consultant doing a lot of board work with trustees and friends and library directors, foundations. I've spent a lot of time listening to people, and then kind of trying to understand, and maybe it's library reference interview skills as well, of like asking questions to be like, okay, so this is what we're saying, this is what we're talking about. And there'd be a lot of, that, like, oh, is this what I'm hearing? Yes or no. And that is really part of my work and my process as well. So I spend a lot of time listening. So the plan today is really driven by what we heard and all of the community engagement as well. So let's dig into that. So we worked, the plan really had like 4 distinct phases, and we're in phase 3 now, but really the plan development work started in the fall. So that's when I spent time reading those reports that Jen had mentioned. There was I have my notes here, the Metro West Community Health Assessment, the Town of Northborough Family Youth Services Department Review, and the Northborough Health and Human Services Strategic Assessment. So those 3 documents I spent a lot of time reading and understanding, helped provide a framework for starting to engage during the survey and kind of saying, okay, here are the themes that are emerging out of these reports. How can we learn more about that, specifically from Northborough residents and community users? And I'll say with the survey, that really is going to connect with library users. So people who are already using the library, have a relationship, receiving the newsletter. So once, so sort of that set the fall, kind of understanding the context for the project, beginning the survey development. And then phase 2 is our community engagement. So this was our survey, collected all that data, analyzed that, kind of started to see what themes emerged from that and what we would like to know a little bit more information about. And that set us up for the focus groups that we had. So we had 4 different focus groups with 17 people, one of which serendipitously had 3 medical practitioners in it. So that was not planned to have a group, but it was incredible. And I think the insight that they provided as doctors and nurses for their direct care of patients helped, I thought, provided some really valuable information for the plan. And there's also just people in the community with health and wellness concerns as well. So we had one with the municipal staff as well, which was a lot of the partners from Be Well. And that really was those questions and seeing how that group worked together in those dynamics, which was great. I loved it. I'm like a municipal nerd. I love anyways. Also thinking about how to provide high quality services across the municipality, but also making sure that there's not mission creep for the library. Like, what is the library have the capacity to provide? What is aligned with your mission as it is today? What is your lane? But in partnership with all the other organizations in providing service delivery to the residents of Northborough. And then stakeholder interviews as well. So I talked to these lovely people on both sides of me, as well as some folks who have Isabella Crusoe, who's remind me her title.
The Health and Human Services Director.
Yes, thank you. Which was very informative, and then another community member as well. And then during that time, we also had 2 staff engagement sessions. So work staff through a series of exercises. Work staff, that was an awkward phrasing, but facilitated some exercises and engagement with the staff, which also provided some feedback. And I think that level is really important for me as a staff member, former staff member of organizations that have been part of planning processes. And it's really important that will have their buy-in. They will be the ones executing on the goals of the plan. So if they have great ideas, it's just ways to harness that and bring them into the plan. And all throughout the plan, my goal is to use language that we're hearing in the community to help shape those priorities and those goals as well. And I also had, I count our session that we had together in December as part of one of the engagement sessions as well. So that some of those notes and analysis from that meeting have made their way into the plan as well. So now here we are. It is April. It is freezing cold and snowing outside. Not at this exact moment, but you know, we all experienced a little today. We're developing our plan content. So I've had several meetings with Caitlin and Jen where we've gone over starting to just brainstorm the priorities and the goals, thinking about how it connects to the various pieces of analysis that we've had. I did a presentation to staff last Thursday about the draft priorities and where we were. And that I think also works like this session as like a community engagement. This is the piece of, did we hear correctly? Are we missing anything? So there was even more notes. I took a lot of notes and I'll be doing that again today. I should have led with that earlier. I'll be taking notes and listening. But again, additional feedback will work into the plan as well. And then in May, we'll finalize that plan content. But also part of the plan will include, you know, Jen was really, and where I was really attracted to this project as well is because it's also connecting it to data and outcomes. So how can we measure what it is, our goals and what we're doing? So now that we have a sketch of what the goals are, I'm looking for data sources that already exist, collected at the state level that we may be able to sort of use and map to kind of study progress and then think about ways we might measure that as a library as well. And then also looking for grant and funding opportunities as well, now that we have some more of an idea of what the plan components will be. And so that will be our goal is to have this all wrapped up kind of about by the end of June in the fiscal year. So, you know, March and April, it's April now, really continuing drafting that, and then we'll have that finalized May, June. So any questions on timeline? Okay.
Yeah, please. Just the component that goes after that is, this is all the high level aspirational goals. Like with a strategic plan, the next step for that is for staff to really dig down into those specific action items. So, you know, we'd be looking at each of these strategic areas and saying, what specifically do we want to go after? So, you know, maybe in year one, we're picking a few areas of focus that we're really going to look to improve on or highlight. So the plan will get more specific with that action plan from here, but this document should be the next couple of years. It should be good for a while.
Yeah, no, thank you. Yeah, that's important. Yeah, so I'll help develop a first year action plan as well, which will start to be a little bit more specific. And in my approach, I think our approach is in doing a plan is that we have our priorities and goals, but they're really written in a way that can touch all the departments within the library. So children's, you know, whether different the populations that we're serving, as well as technical services, circulation, reference, or, you know, outreach. So everybody has their work can connect to those goals and priorities. So this is just our kind of a review of what I just said, a community engagement, but these, so themes really emerged throughout the conversations and the community engagement analysis, which were demand for health and wellness problems. Is that easy to move?
Yeah.
Great, there we go. Community demand, health and wellness programs, accessibility and engagement challenges, expanding literacy, community connection initiatives, and then community-centered collaboration. briefly, I just want to connect it to kind of just again grounding your project into your strategic goals, the strategic plan as well. So this work is really aligned with what your goals are already. Okay, so now let's get into the actual plan work. Do we have a hard stop at 8? Okay. All right, I'll try to manage time. It went a little bit longer than I thought. All right, so our first okay, so our first priority is be connected, and then in our conversations, really that be kind of connecting it to that be well, that little bit of branding, kind of helped provide some structure to this plan. So be connected, and then a vision statement. We build relationships, creating opportunities for our community to foster meaningful connection and a sense of belonging. So, oops, doesn't forward when I click it on mine. Hopefully you can all read that. So the 5 goals under Be Connected are to create programs and spaces that encourage meaningful interactions between community members of all ages, design library spaces and resources and programs that are accessible. Sorry, I realized I have a typo there. Engage with the community by participating in local events, building relationships, and being present in spaces where the community gather. And then there's also internal goals as well. So some are the staff library activities that are programs, services, spaces, but also kind of the work that the library staff and library workers will be doing. So in that first one of those is cultivate and develop relationships with municipal departments for that high quality service delivery, and then develop clear policies and procedures to ensure secure, equitable, and confidential access to information and resources. So with this priority, some of the engagement that we heard that really drove this was about social isolation, right? So wanting the community, wanting to feel more connected and engaged. The survey was delivered around Apple Fest time. So there was a lot of comments of like how that people felt very energized and engaged about that. But we also had an open text question asking people to tell us a story about a time that they felt connected to the community. And one of the themes throughout that was about, kind of community-wide events, which also touches on that third one, engage with the community by participating in local events, but also events that were really for everybody, right? They could have been for families, they could be for older retired folks, people without children, kind of empty nesters. So really something that there's something for everybody at an event, but they're also engaging with everybody at every phase in the community at that. Accessibility, I would say, is always evergreen, thinking about physical spaces, but also there were some comments about participation in programs and not being able to hear sometimes the speakers. So thinking about the importance of, the kind of this marketing we'll see in another one, but like drawing people in, but when they're in, making sure they're able to fully participate as well. And also thinking about this materials and languages, there's a need for that in this community as well. And then the internal ones were really driven. I mean, the first one I think is kind of just talking about be well and like that collaboration with other departments. But the one about policies and procedures came out of conversations around building trust with the community and privacy concerns as well. So how do we, I'm going to say we, I mean like the library, but I'm part of the team. Develop the policies and procedures to ensure that we are having those interactions and providing information and being mindful of any digital footprints or a particular landscape where health information or information about people might be asked of us by government officials. How are those handled? And we already, I know libraries as have policies around that, just like circulation records, but how can we maybe think about those policies and procedures for reference interactions as well? So that is where that one came out of. And I think in staff conversations as well of wanting to ensure that the community knows can turn to us in that way or be entrusted with them. And oftentimes, I know from experience as a reference librarian, people ask very sensitive and private health questions to the reference desk. And it's, a privilege to be able to help people. And they do really, I was struck once in my early reference jobs when somebody came in like, well, I just get right from the doctor to this diagnosis. And, I was like, wow, like you came right to you came right to the library after you received this diagnosis to get more information to learn. And it's really stayed with me all these years about how much that person trusted the library to find information. So now I'll leave it for you all for some discussion around this. So kind of going back to our meeting goal, does this seem to capture the community's needs and aspirations? Does this goal reflect what you've heard in the community? This is where I go. So I kind of have three questions just for starting. So does it reflect what you've heard from the community? Is there anything that feels unclear or could be better articulated? Or if you could refine any of the goals, what would you change?
Jonathan really this has been on both sides of the issue for librarian and library trustee. I don't think we have to specifically say interacting with schools, but I think it's a good thing that we would consider that as part of the opportunity. I'm just thinking in terms of summer reading. That's always a bless. Sorry.
No, I
guess I've been on both ends of that.
No, it's so fun.
And because that's where you're going to get a lot of your future. Doesn't have to be huge, but I think it would be good. These are gifts. Put that somewhere in the thought process. And it's like, but this is one I think.
Just anecdotally, we had started to with some of the kids that we see that something. We're seeing maybe a higher level of say gently behavioral problems. It's a much younger crowd than we're used to seeing those issues with. So rather than just not engaging with them and we've been sort of engaging the schools in some discussions about how to work collaboratively with them to see if they're seeing the same things and what can we do and how if they could be referred to service that the school has that we don't have, or if we see families that have school-age children that need services that the school provides, just even awareness of what they have and what they offer. So there is a 2 or 3 year age group that I think COVID hit differently.
And I really love this, and I really like the emphasis on this sense of belonging. It's also something in the school district that we're really working on too. But in looking at the bullet, design library spaces, resources, and programs that are accessible, one of the things I see missing here is kind of culturally responsive as well. The demographics in Northborough have changed significantly in the last decade, and that's just something I'm not like really seeing reflected here. And it could be based on who we talk to in focus groups and things like that. But I do think that's something we really have to think about if that sense of belonging is a priority.
You're taking it. I've read it several times and ambitious and from the option.
This question in a slightly different way.
Oh,
Before we
great.
move on to the
Please.
PowerPoint. Does this goal sort of resonate when you read it? Sometimes assignments, it's
We're good, we got you.
yeah.
I appreciate the nine hour external and internal. No, I'm agreeing, and in addition to appreciating what I see on here for this goal and reflected in all three of them is I liked seeing that there was an external facing and then an internal, like holding ourselves accountable. This is the extra work we'll be doing internally to make sure that we're elevating these goals that we're projecting.
All right, well, let's move on to our next one, which is be informed. Informed. We provide our community with access to information and opportunities for lifelong learning and empowering decision making. We provide our community with access to information and opportunities for lifelong learning, empowering decision making. So our goals here are being informed, right? Learning, taking in that information, being able to make decisions for oneself with that information. Promote health literacy by providing access to reputable resources. Ensure community members have the skills to navigate and evaluate information in a changing world. Build a wellness hub with information and health and wellness materials. Curate thoughtful collections with input from community members. And then 2, internal, strengthen library marketing strategies, balancing reach with meaningful engagement. And finally, invest in a culture of staff training and development. So this one I felt was really guided, specifically, we're calling it out, specifically health literacy. So if we're talking about health and wellness plan, thinking about health literacy seems really important. Providing access to reputable resources. We all probably rely on Dr. Google at some point in our lives, today, maybe even. What is that weird pain in my foot? But in doing so.
Yeah, we think Google has failed me.
That's your thing. Like, yeah. But you can't do that. So I keep going down. Fun to get some stories.
It's not that guy with the Camaro, we all go.
There's a lot out there, and helping provide that access and understanding what are the reputable resources. The second goal is really connected to kind of all types of literacy as well. Basic literacy, being able to read and understand is important. Digital literacy is so much, we rely on so much about technology when accessing health information. So being able to use it, understanding what this information came to be. And then there was a lot of, through the survey revealing, and then we asked this in our focus groups and interviews about the role of AI. People saying that they use it to, like Dr. Google, go to Dr. Chat GPT, to kind of learn about health systems. And there's been some studies about that recently as well. So wanted to call out health literacy specifically, but then talk about all types of literacy as well. Being informed is also about materials and collections. So a wellness hub with information, health and wellness materials. I think this is some work that's already being done with fentanyl strips. And I think there's another takeaway item in there. Or
If you've ever been on the second floor near where the teen and adult programming room is, on top of the short shelves, we have a cardboard thing with some rack cards that have different health and wellness topics that have reliable information. I think they were from so we have a few other scattered things that have been created by health services or Encompass. So we try to keep it all collected together with the resource guide so that people can access the information without asking for it and without other people necessarily seeing what they're doing. I think that's especially important with the fentanyl district. Don't really want you to know. Oh,
I think that kind of strikes at some of the themes that came out through the survey and interviews were around. And like we were having conversations about how mental health isn't really called out specifically in the plan. And like, I think that's a conversation to have. Like, should it be? Should we be explicit about saying that in one of our goals? But I think the wellness hub in our conversations is one of the ways of responding to like stigma of asking for information or privacy, of being able to have like self-service and access to information. And it can also, could be on really sensitive topics, about, looking for fentanyl strips or dealing with addiction, but it could also include things around like healthy aging as well. So there's a whole, a variety of topics that could be explored in that area, which also I think could help in a way reduce stigma, because someone's over there and it's not just the topics that people might not want to talk about in shared company. There's a whole variety of things over there that someone's looking at. Curate thoughtful collections with input from community members, and maybe this is touching a little bit about the idea of like culturally responsiveness. But I think this, Jen, through that grant that they received about working with the community members and having collections. So, just the idea of co-creation with the community and having their input into the collections as well. Not handing over collections at all to the community, but where appropriate, engaging with the community about resources. And then our internal strategies around are the library marketing strategies, and then a culture of staff training and developments. Because again, none of this work can be done without staff who are trained and have the time and resources to be able to develop their skill sets and learn about the information in a changing world, like opportunities to learn about AI and how that's impacting our world, or how to use it. There's plenty of applications for it as well. So that sort of summarizes those goals. So maybe just start with what Jen said, which was so great. Do these goals resonate?
Let's talk about the second bullet.
Sure.
And make sure that we are, your point is mentioned, we're staying in our lane, we're setting folks up for success. Is it more accurate to say that we're supporting community members as they develop skills to navigate? Is it up to us to, what if they, or magenta word ensure?
Yeah.
It's the wording that we're gonna make sure you have the skills.
Yeah.
Is that our lane and is that our responsibility? You wanna make sure that we're seen in the right light. We're here to help you get what you need. We're not gonna make it happen for you, that there's a responsibility on the part of a community member, the patron who comes into the library, that, skilled, having just gone through my annual review, skill development is up to me. So again, as they're coming in here, we will do whatever we can to help you get there, but it's up to the patron to get those skills. So again, it was really the word ensure. So I said a lot of things about one word.
Yeah, no, and that's really what this is for, and I think as we spend more time with it, like, I've been like, "Oh, maybe that's not the right word," and as I say it out loud again, it stands out to me, so this is also about wordsmithing as well, so thank you, I appreciate that. Yeah,
I think in the first bullet, I've said this before, but we live in a society today where information is a mess. And people really don't know, sometimes don't care, I suppose, if they're getting actual information or not. So that word reputable is critical. I'm not entirely sure how we will do it, but it ought to be high on our list of priorities as librarians to help people understand the sources from which their information comes. And it's a difficult thing to do because people have such faith in the internet itself as opposed to the sources that sit on the internet and provide the information. And sometimes they think if they just go on the internet, Google, whatever, pose a question, whatever comes up is reputable. It's not necessarily. So that's a really tough thing, and I know the schools are actually doing it at the lower grades. I know my grandchildren are getting some instruction in those things down in Connecticut. So, but I think it's got to rise very high in the list of priorities of things that we actually do to help people get that information. We don't tell them necessarily what the right information is. That's up to people to decide for themselves. But we help them differentiate among the various sources out there as to what is, accurate and what is not. I don't know if I said that properly, but
No, you definitely did. It actually came up during that wellness fair we had last week. So I had a registered dietitian come out and we did a simple program on how to build a better lunch. So it's like, instead of giving in like I do every week and go to Wendy's once a week, which I hate to admit, we actually had people. Yeah, that's my the little devil on my shoulder over there. But it actually came up. So when she came to talk about the lunch, we actually had a couple people that came and were super engaged with her and were asking, so I'm on TikTok or I'm on Instagram Reels and this dietitian says, well, I can't have this because it's not healthy. And she's like, but I don't know if they're a dietitian or if they're just saying they are. And so with the influx of like health influencers who are saying like, you can't drink water, it's terrible for you, or eat this brick, it'll make you feel great. It's like, but there are some that you can find are immediately ridiculous. And you're like, no way, like this is not real. But then there are the really subtle ones that really just are like, oh yeah, like they have a point. And she got a lot of questions on how to find out if that information is accurate. Are they who they say they are? And and what is trustworthy and what is not? And how do you find it in the quagmire that is the internet? So yeah, I completely hear what you're saying, and we're already seeing it So, yeah, no, I completely agree with you that it's somewhat like our highest priority now is like finding what information is accurate and reevaluating current resources. Because goodness knows what we'll see. So, yeah.
Constantly calling. I have two kids in elementary school, and we're in New Jersey. New Jersey is one of the first states to adopt a law that for information literacy standards. So the state library has an IMLS grant to work on developing those standards. Hopefully, anyways. Yeah, hopefully that work continues regardless. But just like conversations, I mean, I feel like I'm always telling especially my older, I'm like, just because somebody said something doesn't mean it's not true. But I also want them to believe me. And I know that should come back to me, but I think like trying to provide that, like when appropriate, that critical lens of thinking as well, especially for generations that are growing up with ubiquitous internet.
I think the challenge is people used to come to the library for information
Mm-hmm.
and now they have access to it elsewhere. So now is the job becomes guiding people to good information.
In the top four, which are sort of the outbound items, don't know how much is the intent. They read as being very passive in nature. And I mean, marketing is clearly, you know, on the internal one, it's clearly an external, it's a proactive item. I get the feeling that that's not the intent for it to be entirely passive.
No, not at all.
So to me, if I were just looking at this, I would say this is about putting things on the shelves, and when someone happens to come in, you can help them out. I think there's also, I know, a real interest in the need in being proactive, of letting people know that this is available and trying to some extent, within the lane that is the library, meet people where they are. I think that's advantageous to do for the library as a whole.
Okay, yeah, thank you. I appreciate that. Yeah.
Third bullet point. I like it. The build a wellness hub, as you were describing it, it sounds like the intention is a physical space in the building. Is there also a digital component, like a digital hub, or is it just the?
It could be, we have, I have aspirations for the community resource guide as it evolves. Not do a major printing of that to go out to the community again. But we do have that magnet with the QR codes that directs them to an online thing. So a lot of that information that we're talking about with the community wellness hub that's in the physical space is captured there, but I have aspirations to make that more accessible because right now it's which is not great. So that would probably be like one of those action things to dig down and think about how we make that information accessible.
Thinking that too, you could make some really cool collections. I agree, and it sounds a lot like collections and books. But I think about the library of things and how could these goals interact with that. There's some really neat opportunity. I mean, already pickleball set, those kinds of things. But I think you could have a really cool partnership with wellness goals and the library of things and grow that collection a little bit.
Yeah, one of the great things about being a consultant and having various clients is you go to one library and you're like, oh, I have to tell my other client about this. Which was healthy aging kits, really about like memory development. So it was like, and they were like thematic. So one was like baseball themed, that had like a baseball puzzle and memory cards and like trivia games. So like, you know, could be a great tool, you know, for somebody who really loves baseball, but it's also have some things that we know can help with brain health as well.
I've seen too, like some local community members, for example, the dietitian team are sometimes willing to offer a museum pass type of a thing as well. So you could get one visit with them if you check out the museum pass and you know, sometimes like Great Gym or North River, I mean, I think there's lots of opportunities for that too, for like local wellness resource.
Yeah, we did that as a pilot. During Be Well, we had 3 local fitness centers that did like a fitness pass.
Yeah.
And capacity wise, we ran out of time to develop that idea, but it is it's connecting back to the community because you're using local professionals who are invested in the community. I know there's a desire, especially in this town, to sort of shop local and use small businesses, professionals that work and live.
Thank you for that. That made me think that like, is there something missing here about programs and like how you might connect people to experts within the community? So things like social worker office hours, or are there other, you know, folks in different municipal departments who would come to do office hours, something like that. So thank you. Yeah.
There's a, physical therapy clinic in town that runs repeatedly free workshops for people on various topics. And the last couple of years, they've been doing them at the senior center as well as at their own facility. And that's something maybe the library could start offering here. They're not trying to sell anything. They're offering the, you know, the information about the health benefits of osteoporosis, whatever.
Thank you.
I was just gonna say, you know, but back to the last comment was it's, you know, building on what you're already doing with like the CPR trainings and the Narcan trainings, like those things are already happening. It's just kind of putting this.
Resources.
To our next one, be active. We inspire participation, engagement, and action through physical programs and community organizations. So our goals here are integrating physical movement into select library programs, empower community members to engage in volunteerism and local government, support healthy aging through. Oh, sorry. Support Laura with her technology.
To be fair, there's 2 keyboards.
I know. This is I'm used to just being on this at home. Empower community members to engage in volunteerism and local government, support healthy aging through programs, services, and partnerships. And then internal are embody a culture that supports health and wellness for library staff and seek out sustainable funding sources to support health and wellness resource efforts. So the last one, I think we touched upon earlier about looking at grants. So this one, you know, I think is about thinking about being active in yourself and then active in the community as well. So physical movement into select library programs. This came up in conversation. This was, you know, a lot of high interest in the survey, and people talked about how they like, you know, like yoga or chair yoga or things like that. And in our conversations, it's also important that what's offered at the library doesn't dilute the offerings, the paid offerings that like the rec department and like that are hosting in the town. So again, it's going to be within the lane, right, of the library. But things that we had talked about, you know, as we're brainstorming, coming up, you know, started thinking about like actual like action items or like, oh, what could that do? So like, you know, story walks, I think are an example of physical movement, you know, reading story, walking around, or if there's ways to, you know, integrate it, you know, where possible. The next one about engaging volunteerism in local government. So in that open-ended text question we asked about a time people felt connected to the community, there was a lot of responses about, I felt engaged when I'm volunteering, you know, when I'm engaged with my church or a local organization and volunteering somewhere, I feel really, you know, connected and engaged with the community. And, you know, so this thinking about ways to, you know, that just feels good as well, like giving back and helping organizations and folks who have a need. So, thinking about how to engage in that, and then also part of the local government structure as well. Like you can run for office, or maybe you have some boards that are appointed. I don't know, but this one, you're great. You know, that's an evergreen issue, right? So thinking about the library, that how could help with those efforts. More specifically, we talked about healthy aging through programs, services, and partnerships, and this came out through some of the survey, and then, you know, through focus groups and interviews. So people, a real desire to stay in the community and age in place in communities and age well. Hopefully, you know, aging is a privilege, so being able to support that as well. You know, one thing that did come up, which is really outside of the library's capacity to influence, is about housing, right? The high cost of housing in Massachusetts and the area and how expensive it is. So, you know, the library isn't really able to, you know, as a priority or goal, like have any influence or capacity to help make sure people can afford to stay in their house, right? But like, where possible, supporting healthy aging. You know, we talked about like library things ideas or different dementia. I think you're kind of that program as well. So, you know, I think, and then the next one, embody a culture that supports health and wellness for library staff. So I think this is like taking our own medicine, if you will. So if we're committed to doing work for the community, helping them achieve health and wellness goals, you know, having a culture within the library that also supports health and wellness as well. So, and then again, funding sources. Feedback, wordsmithing. I definitely hear things as I say it out loud again. Yes.
I don't think this needs to be written into the plan in any way, but something I've been thinking about, as we think about community, as we think about wellness, is pets and connections with people and their pets, but also pets as part of the community. And I was thinking Worcester Public Library did a program over the holidays where they had like a vet come in and talk about like access to your pet stuff, stuff like that, but just like, you know, also engaging with like animal health care professionals might, I don't know, broaden the reach maybe a little, or make some appealing marketing.
Thank you for saying that. When we did one of the exercises I had to do with the staff, which was about like kind of like designing a program, like what would it do, what would it look like, how would you know when you achieve your goals? And someone came up with something about pets. I think it was pets and plants. It was like, you know, what plants you shouldn't or shouldn't have because your pets might eat them, but also like how, you know, pets can help or caring. So anyways, thank you for saying that as well, because when I heard that idea from the staff, I was like, that is such.
Yeah, we still have the program on Saturday mornings where people want their dogs and
We have I think there are 2 dogs that come in regularly where, you can book a time and read to ask
yeah,
them.
we get them.
Yep.
And then we did, an adult program that was actually really well attended. It's along the same lines of what you were thinking. So we had a vet tech come out to us and she mainly works with cats and she loves cats. So we did a cat-tastic creation thing. So she gave you information. It was a 2-part series where she showed you how to hand crochet a cat bed while also giving you facts about like health facts about cats. And if you had questions, she'll tell you anything you wanted about cats. And as soon as she came, I was like, I know exactly who you need to talk to. Here is Kate. So I like her, but it was actually a very well attended program, and it was something we never would have thought to do outside of this person saying, "Hey, I'm a local vet tech. Let's do this." I think there's definitely more we could do with that and build off of it, as well as use some of those. Now I'm sitting here thinking, I'm like, oh yeah, because we have some like offsite places that might work, or
Reading with rabbit.
reading with rabbit.
We did a
Listen,
children's program where it was supposed to be reading with rabbits, and there was supposed to be multiple. Right, there was one rabbit. We read to rabbit. The other thing that I think too is even more low key. Officer Sullivan comes by with Marshall every once in a while, who is massive, by the way, and not yet Cobra. Man, every time I see him, he's doubled in size. And the joy that people get when they can pet a dog in the library where they were not expecting to be able to come in and Marshall to him, he rolls over on his stomach. Just even like those little simple things that are maybe not even announced that just bring a little bit of joy.
Well, and to connect back to that first goal, reaching out, you mentioned the schools. The Northborough and Southborough K-12 school districts have a whole therapy dog program with teachers. There's like over a dozen trained dogs at this point. So that's like another opportunity. And those are dogs like a lot of the kids recognize and know and families. So I think there's a lot. I know you don't have to open our dogs up story walks. So. Incorporates them across the board. Amazing.
I was like, don't want to be able to do like the visual corn maze with your dog.
They're spin around. It's great.
The invisible corn maze to the first.
We spend too much time lurking around the outside of this building.
It's yours. Like, you know what's actually in it. You'll look and be like, that's it.
That's definitely an untapped well that I think is something we could definitely take advantage of and put more thought. Something like that. I'll show up with the horses in a week.
I think the call makes it with like the craft and facts, like I like that, like that's really cool.
Yeah, it was really fun. She just came and pitched it out of nowhere. We were like, yeah, let's go for it. Like, we're in.
I think it helps with the health and wellness for library stuff. I mean, when we have those interactions, those are the ones that very heavy with people in crisis, have complex needs or just heavy needs. Interaction doesn't end when they leave. We get them the information and we get them where they need to go. There's a part that sticks with you after that. And there are several of those that particularly one where through the course of about 45 minutes, a staff member and I assisted home who absolutely needed something right then and there that we could not provide through the phone. Not provide to them, but both shifting. I think it took us both a couple weeks, maybe even to really like fully let go. Because we don't always get the phone. We get the need, we provide the information, but there's an emotional toll that this work takes on you. And without the proper culture to support staff after those interactions, during those interactions, you lead to burnout and then just a mental disruption. Responsibly aware to think support each other after those interactions.
That goes back to the point in the previous slide about staff training. My wife is a nurse and my youngest daughter is an ER physician. And they have learned how to bridge the gap between empathy for the patient, but at some point, you have to be able to, your own sanity, you have to be able to draw the line and, and cut things. But training is the way you get it.
And our training, especially for MLS, yeah, it doesn't cover how to rebound or distance yourself. Like, we don't get that kind of training. For care that like focuses on like building.
Which is great. Partner. Right, but as libraries, embark on work like this and just people come to us, which is a gift in some ways when they're in crisis and they need something, as like we're a trusted, safe place to get that information. You know, we also need to develop those skills of setting that internal boundary, and that's hard, I think, you know. Yeah. Right.
Oh, yeah, so that was just reminding me about the crisis prevention training, like that gives you like the skill sets, like they teach you the steps to take in order to like cool like down from an interaction, the steps to take to like make sure you are handling whatever this trauma that just happened to you, like, and how to handle that. So that way, like the impact on you is less. I'm not saying it how I would like to say it, but how that, you know, it gives you those skills to be able to say, okay, here's what I need to do now for like my mental health. Here's what or like, if I need like a staff member to intervene and help me with this, like, then I need to know, like, this is what I need to ask. Because those kinds of trainings are incredibly important. And yeah, that's something we could have them do. It's actually, I've already kind of working on that for a staff training day. It won't be till later, but yeah, it really helped me. So like, I feel like things you break down. Yeah, no kidding.
And next week, we do have our staff development day where we are actually doing offsite. That's to be closed for a full day. That's this week. Is that?
That's Thursday.
I don't know what today is.
That's valid.
It says right on the door.
Oh, today's the 8th. Okay.
Time flies when you're having
I thought it was like the 4th today. It's not correct in any way, shape, or
Time is irrelevant.
so in 2 days, we will all receive mental health first aid certification training. That is very similar to the first aid certification. That's an 8-hour, very intense day, and I think we'll learn some of those supports, but also the other side of it too, with when we are dealing with somebody we start to recognize may have some kind of a unique, how to approach that conversation where what they're asking us for might not actually be what they need. And maybe they don't know how to ask, and even with each other, if somebody's not okay, be able to have the understanding of what to say and how to start that conversation with somebody so that we're better supports for
Thank you all for your really thoughtful conversation and feedback. I really, really appreciate it. I'm happy if Jen shares my email with you if you want to, you know, if you're like me thinking about things while you're watching the dog, out and about, washing the dishes, feel free to drop me a line. I'd be happy to have any additional thoughts and feedback. So our next step with this is really to kind of synthesize the feedback from this session, which was really helpful, and the staff, and continue to refine the language in the draft plan. And then start, you know, continue to move to a final plan, which will include mapping to data points and current opportunities, first year action.
for everybody.
great,
And I don't
sure.
know, you may have already known. I just love it. Just to step out and zoom out of the plan, is there anything that you feel is not addressed at all in any of the goals? Or
Is there anything, that hasn't been addressed at all? I didn't think we need.
if you think of anything?
How about, I know the development of this involved other town departments. The delivery of this also. Remember seeing pieces up there, maybe I missed them. You asked it, then I'm thinking about it now. To make sure that the delivery involves other town departments. The one thing that came to mind, the story walk that's been brought up a couple of times. We just opened a trail behind the senior center. It would be really cool to have a story walk there focused on adults. And that could be a bridge between the two groups. That's just
Oh, you're like an opportunity.
Yeah.
a random.
I completely forgot that happened. That's
Yeah.
really sad. I was like, man, I saw you there. That's a great idea.
So that's, one opportunity that the people that regularly go to the senior center aren't necessarily the people that regularly go there, and
Yeah,
vice versa.
yeah.
Adults of young kids here going there, I think about ways of
Yeah,
cross-pollinating the departments to increase each other's value.
yeah, yeah. Yeah. That's great.
Yeah, and we've been talking to, Dana from Loughborough Cable since we've had all this lovely stuff now, about ways that we can partner in thoughtful ways to create, content, whether that's just recording some of our presenters or our local author visits, or even just like, if it's not a public program, having somebody maybe come in and record like a short, information literacy sort of commercial type thing. Like, we're not content creators. Caitlin and I have been attempting and failing a bit like this. We've learned like we're not great at some of these things. Like, I will never be an influencer. But Dana has that expertise, and Kaylee for that. So happy to come out and do those things if you have the times. Just looking at ways to form even stronger partnerships. So part of
Part of the first goal.
Yeah.
Yeah.
But this will also, like, we had an input session with well, and then we added we had representation coming home as from Cable and some of the departments that weren't initially part of Marlboro Cable. Encompass is not a department, I don't mean to on that, but they're connected to Health and Human Services. So this will go back to them so that I can help them understand. And the Youth Commission has asked me to come and talk to them about the progress. So I'm on their agenda for, and this one is probably not, hopefully not tomorrow, since I don't know what day it is. But they're very interested in the work that we've been doing with this and how that's going to play out and how they might be able to. So that's a partnership that we haven't really explored yet. It's as the marketing document for the library about telling our story, that will be.
And thank you for taking time here, not for all of your meetings from, but anyways, but for your time this evening, I really appreciate it. And, I think your support of Jen and Caitlin on the project. Very privileged and honored to be a part of this process.
If we are done with the discussion of the wellness plan, the next item on the agenda is the date of the next meeting, which very important, Jim.
Right down to the minutes.
Oh, I love it, we're all in the same room. The date of the next meeting is not the date that's written on the agenda because yet again, I failed to remember that that's election day. So the next meeting will be May 20th. 2025 at 7 p.m. Did we get the okay to be remote again?
Yes.
Yes.
For 2 more years.
For 2 more years, thank you, I thought.
So that one will be remote. You can look forward to presentation about the use of meeting rooms and to our last month's discussion. And very excited. Michelle.
Can't wait. Can't wait. Is there any other business that can come before the board at this time? Seeing none, the chair would be delighted if someone would make a motion to adjourn. Thank you, Mitch. And Jocelyn seconded. Thank you. And I don't have to do roll call, but all those in favor of adjourning the meeting at 8:32 p.m. say aye. Aye. Opposed? The motion passed. You're done.